Okay, so in this podcast, we're going to be talking about the nursing process. There's going to be a few podcasts that are going to be posted regarding this because this is an integral part of, well, basically nursing, because this tells us really how we're going to go about and do our job, perform our duties, how we're going to take care of our patient. And the part, though, that I want to focus on out of the overview is going to be on critical thinking. And the reason that I want to do critical thinking here is because, well, first of all, it's how you're going to arrive at your decisions. But second of all, you need to be able to, again, pull that internal process out and become aware of it in order to find the areas that you need to improve as a clinician, improve as a person, and that you need to improve in your delivery of care before you tuck it away back and it becomes an internal process again. And this is something that is integral to not just nursing but also medicine, is that because we are dealing with people, we have to, and we're dealing with people in very sensitive and very vulnerable positions. We have to have that ability as practitioners to take our internal workings, pull them out, and look at them externally and examine them, make the changes, and pull them back internally. So that's the whole point of this particular podcast on critical thinking, this inherent internal process. We need to scoop in, pull it out of ourselves, look at it, splay it out on the table, look at it, make the adjustments, and put it back into ourselves. So that's the whole purpose of why we're talking about it here today. So critical thinking. What is critical thinking? We talked about it in lecture already as far as like the really deep down integral parts of it. But this graphic, this actually comes out from another nursing book, is a really good simplified version of the critical thinking and how it applies to the nursing process. So we have this cyclical triangle, if you will. Go ahead, you can review your geometry. I just made up a whole new concept there. Cyclical triangle. And it combines these three segments: the nursing process, nursing knowledge, and then critical thinking, which is its own component. But really, all three of these things kind of run into each other. You need to have one in order to satisfy the other two. And of course, as we talked about in class already, the components of the nursing process is, again, this mnemonic ADPI: assess, diagnose, plan, interventions, implementing, and evaluating. So they have two I's. It's the same thing. Interventions, implementation. Again, plan, implement, evaluate, and it comes back to assessing. Those of you who like the sound of music, and it brings us back to do, brings us back to assessing. So it's always that cyclical process, but it is, again, one category within this whole thing, and that is the nursing process. Then we have nursing knowledge. We'll break it down into the practical and the theoretical. And then we have critical thinking, which of course also branches out into skills and attitudes. So let's take a little bit more in depth, at least, of these first two. So critical thinking and nursing process. These are two separate things, but we need both of these skills in order to successfully accomplish patient care. So critical thinking, again, break this out a little bit more. And I have these things, again, we can go back here to this nursing knowledge and critical thinking. There are two separate categories here, but really you need, again, going back to this concept of you need one without the other. So they go back and forth between, you're going to flip-flop and forth between what you know and what you have to do, how to, I don't want to say how to apply it, but again, what you know, the knowledge, the critical thinking, what you do. And then nursing knowledge, again, broken into the theory, which is why, the why we are doing this. You hear me all the time on the clinical floor going, well, why? I sound like a 3-year-old. Well, this is, well, why? Because you need to know the theory, because that's going to translate the practical of how you're going to go about doing some sort of task. And then, of course, the critical thinking is also broken into the skills, and then it's also not just about doing it, but it's also how you project yourself internally and externally of how you're thinking. And I'm not just talking about if you're in a positive frame of mind or if you're in a negative frame of mind, if you just broke up with your significant other or you're having fighting with them. It's not really talking about that type of attitude. There's a little bit of a difference in the attitude that we're talking about with critical thinking, which we'll talk about in just in a few minutes here. But this, again, I have the nursing process compared to it. So all of this critical thinking is going to tie in to how we go about applying the nursing process, how we're doing our assessment, how we're coming up with our diagnosis, how we're coming up with our plan, how we're going to implement it, and how we're going to evaluate our plan. Actually, all comes into we have to use critical thinking at each step of this nursing process. So critical thinking skills, again, we have these two things broken down into the skills, and we have these things broken down into the attitudes. So let's look at skills, thinking skills first. So definition, of course, we need to start off with that. Critical thinking skills are a cognitive process used in complex thinking processes. So these include several different points. So contextual awareness. You need to know what is the context of this patient encounter. Go back to our vital signs lecture. I harped on this repeatedly. You have to look at the vital signs in the context of the patient encounter. You have to think about nursing care, the care to your patient, and what is going on with your patient within the context of not just that encounter, but also what's the context of this person's life, especially when you get into long-term care, primary care, physician offices. You need to incorporate the real world of which this patient lives in, the situation in which this patient lives in, incorporate that into their plan of care, because that is going to impact the efficacy and their compliance. So one of the big things as advanced practice providers, it's harped on continuously. What are, you've maybe heard this term, social determinants of health? This is going to feel into how well this patient is going to succeed with whatever therapy we prescribe to them. This comes into play in the acute care world as well, especially when we start talking about discharge. So we get this person back from an acute exacerbation or acute illness. They're on the road to recovery, and then we send them back home. We discharge them. Well, okay, so say, for example, now this person who's normally independent at home can't walk independently at this point in time. They're going to do some outpatient rehab. Okay, fine, but this person lives in a 3-story house. Their bedroom's on the 3rd story. They don't have an elevator. They have steps. What's going to happen here? How are we going to, how is this individual going to be successful at home once we discharge them? But also in contextual awareness, you need to also be a mind of social. This is kind of where cultural aspects come into care. What is the context of the person's culture, and how is that going to feed into how you're going to deliver care? What their specific complaint may or may not be. That kind of a thing as well. Go back again to kind of like the coining, copying, that kind of thing with the Southeast Asian cultures. It's not endorsed really by Western cultures, but it's normal for other cultures to do this. Consider alternatives. So you need options in your care. There's more than one way to do things, and you need to be open to different methods. Again, something that I've been kind of harping on the last couple of weeks, particularly with catheterizations and other procedures, is what is the core? What is the essence of what you're trying to do? And that's a really important question that you need to ask yourself. What is the core purpose of why or what we are trying to accomplish. And once you figure that out, you can come up with, that opens the door to multiple possibilities. And once you have those possibilities, now you're going to start trying to work it. Is this appropriate? This is going to tie into your nursing care plans. Is this appropriate? Is this timely? Is this measurable? Is this safe for my patient? All those types of questions. How are you going to come up with these? Well, one of the ways is you're going to do research. You're going to look at the literature, what's been tried before, what hasn't been tried before, but also what is actually effective and what is not effective or what is even detrimental to my patient's health. And this is where you use credible, evidence-based sources. Not Wikipedia, not WebMD. You're going to evaluate the literature. You're going to look at the research, see what's out there. You're going to look at it at a way to see whether or not the conclusions actually make sense. And this ties into reflecting skeptically. So you don't necessarily want to take things, especially out of context, but you also don't want to take things as true gospel. Okay, so and this is another really important thing, is you need to take things with a grain of salt. Again, going back to the context of this patient encounter, is this appropriate? But also the context of whatever procedure or therapy that was given that you're reading an article about. What is the context that this was done in? And is this applicable to my patient, to what I want to accomplish and the situation that my patient is in? Now, granted, there's always room for adaptation and things like that, but again, if you're looking at something for the pure fact of, is this going to be beneficial or not, you need to consider, is this really appropriate? Does this really apply to my patient? And then analyzing assumptions, again, this really ties back in with using credible sources and evidence-based practice. Does the research that has been done on a particular topic or procedure really safe for the patient? Give you an example. So I don't know if anyone's ever heard of the Trendelenburg position. It's where you have the feet raised, you have a patient laying in bed or on a stretcher, you have the feet raised and the head is lower, and we see this a lot. Now there are procedural reasons or implications for putting somebody in Trendelenburg, but a lot of times you'll still see this done as if someone's in shock. The evidence, the research that is out there has definitively said absolutely no Trendelenburg for people who are in shock or hypotensive, because it actually does more harm than good to your patient by putting them into this position. It actually, they study this, and when you compare it to patients that were in shock or hypotensive and they were just lying flat, people that were put in Trendelenburg, more of those people died compared to people that were just laid flat and left alone and used fluids or whatever for resuscitation. And there's also physiological reasons that they were able to track as well. So that's an example of everybody. It's not necessarily a good thing to say, oh, well, everybody does it, so it must be the right way. No, that is not true, especially in today's healthcare society. And as LPNs, you are still responsible for what's happening to that patient. Yes, you have an RN over you, but you're part of that care team. You need to also look out for the safety of that patient, especially in modern healthcare where LPNs are being given more responsibility. There's more emphasis and there's more need for even LPNs to think critically and do critical thinking tasks, because healthcare is moving to a point of care system where 90% of the care is going to be given directly to the patient at the bedside by RNs, LPNs. This area is slowly moving towards that model. You go down in Williamsport, that model's been there for 10 years. You go down to the Lancaster area, Philadelphia area, that's been in place for the last 18 years. Healthcare is moving in that direction. It is becoming a necessity for everybody in the healthcare team, LPNs, licensed persons in the healthcare team, to be able to think critically. And that's why I'm making such a big emphasis on this part of the nursing process as well. So that's critical thinking skills again. So there's 5 different components of critical thinking that you need to be able to address and work through as you are developing your plan of care for this patient. The other half of this, though, are critical thinking attitudes. So let me give you our definition: feelings, traits of mind, using critical thinking with open mind and fairly. And this is going to be the big important thing: open-minded and fairly, thinking fairly, fair treatment. Remember which ethical principle deals with fair treatment and equal treatment to our patients. Okay? We talked about this week number 2, week 1 even, of level 1. This stuff, again, ties into everything that we do for our patients on the floor. So what are some components of thinking attitudes? So independent thinking, you need to be able to think for your own. You can't just take the word of somebody else. You can't just be a taskmaster at the LPN level. You need to start analyzing, you need to start assessing, you need to start making these connections, look at the why, look at the how, look at the what for your patient care. Not just, oh, I have these things that I need to do, go ahead and do it. That's a CNA level. You're higher than that. We're going to the LPN level. You're a licensed professional. So you need to be able to think independently, but you also need to be able to back up, and you need to you're thinking with solid evidence. Other components of critical thinking attitudes: intellectual curiosity. You need to be able to be a self-starter. You need to be self-motivated to look up things on your own, to learn things on your own. And everyone here has that capability. Otherwise, you wouldn't be sitting in the seat right now. Intellectual humility, intellectual empathy, courage, and fair-mindedness. Again, going back to our ethical principles of patient care: autonomy, justice, non-maleficence, beneficence. Where do these tie in to these critical thinking attitudes? So there's a complex thinking process. So critical thinking, as we've really kind of already talked about and established, is a complex thinking process. You need to be able to look at multiple sources of data. You need to be able to look at multiple factors relating to your individual patient. Even if you have 8 patients on your list that you need to take care of, that you're responsible for, you need to be able to deal with each patient independently and individually. You need to individualize care for every one of your patients that you have. And you need to do that through using complex thinking processes. And there's 3 things here: problem solving, decision making, and clinical reasoning. So first of all, problem solving is going to be your number 1 thing that you're going to do. You're going to go into clinic. Then once you've kind of come up with the problem solving, then you're going to do decision making. And clinical reasoning kind of ties both of these things together. That's kind of like the glue that holds these 2 pieces of complex thinking together. So problem solving, you're identifying the problem and finding a reasonable solution. You're using the nursing process. What step of the nursing process would you use to identify the problem? A and D. So your assessment, this is where you're gathering your data about your patient. So you're getting all of this data. Now you have to sift through it, and you have to identify what the actual problems are that your patient is dealing with, and what you can do as an LPN within your scope of practice. And to kind of help summarize that is going to be your nursing diagnosis. Once you formulate your nursing diagnosis, now you can start coming up with several ways to solve that problem. And that leads us to decision making. So now you're going to take a look at all of your solutions that you've come up with your problem, and now you're going to be choosing that best action to take. And the one that we wanted to choose is going to be the one that's most likely to produce the most desired positive outcome. I should add that. So positive. Hold on a second here. Most desired positive outcome with the least number of adverse events. And of course, we always like our the optimal number of adverse events that we like. 0. Now, decision making, this may be having to do with a problem, or it may not be. Decision making is not totally dependent on problem solving. So you make tons of decisions while you're out on the floor every single day taking care of your patients, whether it be, okay, do I need to change the bed now or can I wait till later? Can I get the patient out of bed to change the bed, or do I need to change the bed with the patient in it? Do I take my break now, or do I wait 10 minutes, get this one thing done, and then go? Or lastly, it can be attached to a problem, a specific patient problem of maybe, okay, so my patient's blood pressure is 80/62. What do I do about it? And that kind of a thing. Clinical reasoning, again, like I said before, is the glue that holds all of these things together, that holds these two different processes together. So it's logical thinking that links thoughts together to create meaning, used for problem solving and decision making. And then this is where you're taking your theoretical knowledge, your anatomies, your physiologies, your fundamentals, your nursing process, your nursing skills, your why, your knowledge, and you're adapting it to the clinical situation. EMS is notorious for having to be highly adaptable because they have limited supplies, they have limited resources, but they still have an acutely ill patient that they have to treat and take care of. And you don't necessarily have a great controlled environment like what you do in the hospital or long-term care, but still, even on the floor, we find ourselves needing to adapt and take different bits of knowledge from different areas and applying that to a specific patient situation. And then this is a quote here that I took out of one of my nursing books. Clinical reasoning is reflective, concurrent, creative thinking about patients and patient care. Again, I can't emphasize the creative part more than anything, because sometimes you don't have time to wait for another department to bring up, like you have to get something from Central Supply. It's on its way, but in the meantime, if you don't intervene and do something, then your patient's going to tank, and they're not going to be able to get them back. Or you have the equipment, but it's not quite specific to your patient, so you need to adapt it and attach it in a way that is going to work for your patient in a safe manner. So this is a page, this is a chart that comes out of one of my other nursing books here, and this is something that is really, really important. And actually at this point, if you want to pause the presentation and go down and read through this, because it gives you a really nice overview. There's multiple different types of thinking processes with critical thinking that you can use. It gives a good description, but it also gives you some really good questions to focus your thinking, and to also, again, this whole thing about taking that internal process that you have and bringing it externally so that you can examine it. Use these questions to examine that internal process. and find those gaps and find those pieces that you need to change, that you need to tweak a little bit to really make a good, cohesive process. So why, again, do we care about critical thinking? Why do we care about this whole nursing process thing, but especially why critical thinking? Why make such a big emphasis on this? And it really comes down to the fact that, I'll start actually with the second one in the middle here, clients are unique. Humans are individual. Yes, we have biological systems that are very similar to each other, but they work slightly different than everyone else. So that's number one, why we need to be able to think critically, because we need to be able to adapt, again, to these complex situations that even us as LPNs are going to be responsible for taking care of. Again, healthcare in the inpatient setting, whether it be long-term care or especially acute care, is even becoming even more complex. Office PCP work in the outpatient setting with advances in medicine that allow us to treat more complex cases on an outpatient basis, even those visits are becoming even more complex, not just at the provider level, but also at the nursing level, because we have patients on multiple medications with multiple chronic issues, chronic diseases. It's a lot of education. It's a lot of going through medical records. It's a lot of keeping health history straight. And it's a lot of making sure that patients are adhering to their prescribed therapies. And it's not that simple anymore. It's very complex, especially with the onus on being put back on the healthcare community to really follow up on these patients and prevent acute exacerbations and prevent admissions that could otherwise have been prevented ahead of time if the proper care, if the proper education was given to the patient. And that all this falls, there's a good chunk that falls onto the provider, onto me as an advanced practitioner, but the majority, I would say 90% of that responsibility is falling on the shoulders of nursing, not just the RNs, but also the LPNs as well. Again, coming to this whole point of care model that is the new paradigm in medicine at this point. So that brings us back to this idea of holistic care. And again, this goes back to week 3 of level 1 when we were talking about holistic care, holistic things regarding our patient. So what exactly is, again, this concept of holistic care? In the context of critical thinking, it's a little bit different. So there's something called full spectrum nursing, which we're looking at now, which is true holistic care of your patient. And there's, again, as you can imagine, there are multiple different types of things that are involved in here. So first of all, there's thinking. And this is going to be coming back to our critical thinking, where you're able to use your knowledge and skills to the fullest extent. Theoretical knowledge, principles, facts, theories, this is what you have to think with. These are your tools. This is the basis of how you're going to form your solutions to your problems, how you're going to identify what your problems are. Then we have the doing. Draw a little arrow here. Next step is going to be the doing part. So this is your practical knowledge, what you already have, skills, procedures, and processes, protocols, that kind of thing. And this also includes the nursing process. Now, this is kind of interesting because they use nursing process here as a separate category, but we break it into 2 separate chunks. So this is kind of like our part A, and this is our part B down here. So the nursing process, first of all, we have our assessment and evaluation. This is your data, everything we know about the patient. And this also includes, don't forget about the context now. Now we're concerned about going to this next level of thinking. We need to tie in the context of the patient situation into our care. All right, and then we have the planning and implementation aspect of the nursing process, which is what you are going to do for that patient based on the data you have collected, the context of the situation. Now, for these next 4 sections, caring patient situation, the way I look at it is these are kind of your prism, if you will, that everything is being filtered through. So you have, I'll draw this here, so you have all these things, the thinking, the doing. This is your light. This is like your white light that's going through. Now it's entering this filter, this prism. This is how you're going to interpret all of these things, all of the thinking and the doing concepts. So through the caring principles, the self-knowledge, again, this is where I was talking about in the beginning, where we need to look introspectively, take our internal processes and make them into external process so we become aware of our values, our beliefs, and our biases so that we can do something about it. And then also by doing this as well, we can look at our ethical knowledge or our understanding of our own personal obligations and our own personal sense of right and wrong, because this is going to skew, this is going to bias everything before, bias our critical thinking, bias our theoretical knowledge. Even though it's the same, we're going to put our own little spin on that knowledge, put our own little emphasis on one little piece of knowledge over another. And then also the patient situation is going to further add into this filter the data that we have, the physical, psychosocial, spiritual. Again, this might even tie into some personal bias that you may have internally or even externally about your patient's culture or situation. Then also the context of the patient preferences. Remember our patient rights, autonomy. So preferences for your patient care, environment, relationships, culture, resources you or even your patient at home or in the community may have available to them. And then also support. What's their support network? And then what comes out of that is our patient outcomes. And those outcomes are going to be affected by everything, all of these other concepts that we just talked about. But in particular, those patient outcomes are going to be heavily influenced by this filter here, this caring and this patient situation concepts that we're using to filter through and to apply all of our thinking and doing skills. So this is why we need to be aware, why we need to sit down and be able to look internally and honestly at ourselves and to walk away with something that's much more neutral, something that's unbiased, and something that's fair and that accounts for those patient-client rights. So let's pull back in our ADPI, again, our nursing process. There we go. Our ADPI. So I'll highlight them for you here. So we have our assessment piece, diagnosis, planning, implementation, and then evaluation. Notice the double arrows because we can go back and forth between each of these. So one of these is not exclusive from the other. But look at here. So take, for example, what we have in the star, though, are our critical thinking principles and concepts that we need to use to get from one level to the other. So in order to get from assessment to diagnosis, we need to start by analyzing assumptions. to get from our diagnosis. So we have this nursing diagnosis, and in order to plan care for this patient, now we have to say, okay, we have to be open to exploring alternatives. What are the options? So we have our plan, so how are we going to do it? So now we have to, that's where we go into our evidence-based medicine, our evidence-based research. Use our credible resources to figure out how is the best and safest way to implement these interventions for our patient. And then in order to get from implementation to evaluation, now we have to pull in reflecting and deciding. We have to be able to look back and honestly say, did this work? Did this not work? And once we've been able to do that, looking at the context of our evaluation, where is this coming from? Okay, so our patient didn't walk the 50 feet down the hallway that we wanted him to do so. He didn't walk independently. He had to use crutches. But, well, wait a minute, he only has one leg. So in that context, he did fine. He accomplished what he needed to, what we wanted him to accomplish. How much assistance outside of the crutches did he really need to have? Was he able to work independently for the most part? So that's a little bit more of a deep dive into the critical thinking aspect of the nursing process. Again, this is something that is integral to be able to master as a practitioner, particularly a nursing practitioner. This is something that you're going to use on a daily, minute-to-minute basis. And you have to become comfortable with this. You have to be able to look at this internal process externally, and then you need to be able to internalize it again, and you need to be able to make use of it. This has to become second nature, and it will. It takes time, it takes practice, but this is something that you need to start working on, and that you need to being able to recognize the different aspects of critical thinking.